Thank you everyone for joining us tonight. This webinar is really focused on the staff at the plastic surgery offices. We want you to be able to educate and empower your staff so everyone can be successful getting back to practice and back to work. We have a fantastic lineup. Before we start, on behalf of the Aesthetic Society, I wanted to thank Sientra and Blaine and Sandy for their contributions over the past 2 months, helping us arrange these emergency webinars and making them available online at our website.
Thank you, Dr. Ahmad. Everybody, if you haven't been on one of these before, a couple of quick housekeeping items. My name is Blaine Hamilton with Sientra, and thank you right back to the Society for allowing us to be involved in this important series for the last couple of weeks. Disclaimers is that the presenters today are giving their ideas, not legal advice. All information presented today is based on available information as of right now, today. Also, most of us are not new to Zoom anymore, but if you are, please use your buttons yourself to keep you muted and your video off so that we can run a good program. We have over almost 500 registrants for this one, so that's super important that we can keep things going with a good presentation. There is the chat function at the bottom. Please use the chat and chat away. Stay positive with everyone, but discourse and questions are certainly welcome. Also, throughout the series, there's been a lot of great information that's come from the chat and questions asked that then is posted on the surgery.org website. There's a COVID-19 banner that has all these resources where that information is posted. So definitely check that out if you haven't already. And then similarly, Sientra has put in a lot of effort to include a lot of education right now. So if you'd like or you're interested in practice management growth with Sandy's group, or some good expert panels talking about breast implants and surgical technique, you can go to discover.sientra.com/education. Right now is a great time, if you've never worked with Sientra, to reach out to your plastic surgery consultant and consider partnering with us moving forward. And with that, back to you, Dr. Ahmad.
Great, thanks, Blaine. So I'd just like to introduce you to the presenters tonight. And let's get the next slide, Blaine. So really, this webinar is geared not only to our members, but really towards our staff, to help our staff understand what our perspectives are, what we're trying to do as leaders within the practice, and really enable our staff to work within the team to make this as successful as possible. And so what we're going to be covering is Sandy Roos, who's a practice management consultant with Sientra, is going to give her point of view from the past few weeks working with practices and some of the issues that have come to light. And then we're going to go with presentations from Christine Hamori, Bill Adams, and Louie Rios to talk about different issues that are going to be very important as we're resuming practice and getting back closer to normal. And then we have a lot of time for discussion, and we'll be joined with not only our presenters, but the president of the Aesthetic Society, Herluf Lund. And we're going to talk about a lot of topics, I think, that are going to be very relevant to our staff and will help to provide some clarity, because I'm sure as many of our members, and myself included, we've been hearing a lot of different things over the past 1.5 to 2 months, and we really want everyone to have the same information, accurate information, so that we can move forward in a very coordinated and positive manner. We'll get the next slide here. So there's our great panelists. I think you're familiar with everyone. Sandy Roos from Sientra, who's a practice management consultant. And then our members, Christine Hamori, who also serves on the COVID task force, and they're responsible for the recommendations that came out 2 days ago. Bill Adams, who's helped me plan all of these webinars for our society. Louie Rios, who's now the ACERF president, and then Herluf Lund, who is the Aesthetic Society president. And I'm going to turn it over now to Sandy from Sientra.
Thank you, Dr. Ahmad. as Dr. Ahmad stated, over the last few weeks, we've had the opportunity to talk with many practices. We've been having one-on-one consultations with the doctors talking about the first, 60 to 90 days after COVID and coming back to practice. One of the things that we saw right away was the practice, although they've been doing an amazing job and really communicating with the staff, as soon as they set the "we're ready to go back to practice" date, some of the staff became a little concerned. They had some staff that said they just weren't ready to come back to work. We had staff that said they just, had a lot of anxiety about coming back to work. And so that is when I started looking at, okay, what can we do to really help the staff feel more comfortable with really coming back to work? All along, we've been talking about let's making sure that the patient is safe. And, I think somewhere we kind of lost the importance of making sure that your staff feels safe as well. So about last week, Amanda and Kara and we decided that we wanted to go ahead and start recommending to our practices to have a COVID coordinator in their practice. So the who is pretty easy. It definitely is going to be a staff ambassador. The person in the practice should have a very positive influence within the team. They should also be a trusted employee. And I think the most important thing is that we really don't want it to be an office manager or the physician. The reason that we've asked practices to consider this position, and it's not just for people that are getting ready to go back, it's actually more important for once you're back in practice. So some of the things we really want them to be is we want them to be the point of contact for the staff. What we have heard from the staff is that sometimes they have concerns and they don't feel as comfortable maybe going to the office manager or going to the physician. We also want them to be the one that is going to be the kind of the intermediate in between the practice manager and the staff. We want them to be the one that can coordinate trainings, help listen to the staff and ease their concerns, implement new protocols, and again, be really like the go-between in between the practice, the staff and the practice manager. We've actually had the opportunity to talk with a couple of practices that have since implemented this position in the practice. And I had a conversation with one of them today, the actual COVID coordinator. And she said that she just really felt it was really a position or a role that they hadn't thought of implementing, but what she has seen is that she has had staff come to her with questions, as well as she's been able to witness some of the things that the staff might be doing that she feels really isn't up to the standards of what the practice has set forth for keeping the rooms cleaned and making sure that we're, social distancing and all the things that we really want to make sure that we're showing our patients that we're doing. And I think one of the most important things is that this isn't for practices that, only have 20 or 30 employees. If you have 2 employees, you need to have this COVID coordinator. And I think it's something that you're probably going to need to have in your practice for the first, for the next 60 to 90 days. And again, it's really just a better way to show your staff that, that you are communicating, you do care about them. And again, I think that's one of the best things you can do at this point, other than all of the things that you're going to hear next. And I love that the society decided to put this webinar on for the staff. And I don't know how much staff we have on here right now, but for all of you physicians that are here, make sure that you make it a requirement that your staff watch this, because I've seen what is going to be presented to everybody here. And there's a lot of great information that I know personally that the staff really would find valuable and is really going to help you. And I think one of the things that Dr. Rios had said yesterday or the day before, he had said, all of these things he has said to his staff. But if it comes from somebody else, sometimes they're like, oh, wow, you know what, Dr. So-and-so said that. And so we must be doing something right, or at least, giving you maybe some other things that you can do. So the only thing that I can do right now is encourage you to make sure that if your staff isn't on here, to definitely show them this webinar. And that's really all I have.
Great, thanks so much, Sandy. And we're gonna have ample time to discuss what's been presented and also any other questions that come up in the chat after we have our presentations. So we're gonna move on now, and our next presenter is Dr. Christine Hamori, and she's going to present about some important issues that we all need to consider now related to logistics of starting practice and some of the systems and processes that we have to put in place. So I'll turn it over to Christine now. And Christine, if you can put your camera back on, that would be great.
Okay, so I'm just gonna start now going over some basic concepts that we've come up with the task force, how to safely open the office and things to look at and bring everything into a perspective. So we have to think about, when is it really safe? We have to feel safe, our patients have to feel safe, and it has to be in accordance with law. So basically we have to listen to some federal guidelines, some state guidelines. Basically what we need to do, there's some gating factors we have to pay attention to. There has to be a downward trend in the number of the COVID-19 cases. We have to have PCR testing. It has to be increasing, and we have to have enough PPE or protection for our healthcare workers. The bottom line is really going to be at our governor's discretion of when we can start. And I put up a diagram from the Massachusetts website where basically see in some of the areas that there's a different incidence or prevalence of the disease. So in the Boston area, where there's kind of a darker area in the center of the right side of the screen there, you have about a 1.7, almost 2% disease prevalence there. We're in the area it's a bit lower, it's down to a little less than 1%, which is in that Plymouth County kind of heading toward Cape Cod, which is kind of down toward bottom 3. So when the likelihood of COVID is low is when we'll start being able to go practice. So how are we going to open up? So we're doing screening. We have to find out from the patients and the staff, have you been exposed? Did you have any of the symptoms like a sore throat, shortness, more? But there's a very interesting app available on iPhones only, exclusively, that basically asks a lot of these questions. And in my practice, I was thinking of implementing it. The day before they're coming to the office, we could give them a call, ask them to download this app, and it will ask questions and kind of decide for us whether it's appropriate for them just isolate, whether they can come out and come to the office. So it's quite interesting. When they arrive to the office, we're going to do temperature screening with a touchless temperature gun, as you can see. And people that have a temperature over 100, we're not going to admit to the office. And the most important part is that if you feel sick, it's the patients or the staff is that you stay home. It's just logical common sense. You just cannot come in if you don't feel well. So what are the symptoms that we have to really worry about? And this chart shows a little bit, I found it interesting, the difference between coronavirus symptoms, the regular cold, and the flu. And the things that are distinguished are the dry cough. It's not a productive cough, it's a dry cough, and the shortness of breath. So if patients or our staff are complaining of these kind of problems, it should be kind of a red flag. We should really think that that's an issue. Yes, fever is common and muscle aches as well, but a couple of these kind of herald would definitely be the shortness of breath and the dry cough. So what if someone's really sick? And what is an emergency? What are the warning signs? We would basically say call an ambulance, or call an ambulance ourselves. Would be people that have, shortness of breath to the point that they can't breathe, or they're having severe chest pain, or they're cyanotic and blue. It's kind of obvious, but if they're having these kind of problems, they need to go to the hospital. So let's say we're open now. So what's going to be this new normal that we have? Well, we have to apply these same rules that we've been applying at the grocery store and walking and everything to our practice now. We have to apply them to our office, both with our staff and how we're going to interact with patients. So we have to limit the number of patients that are coming to the office. We have to slow down, might have to make longer office hours. We have to limit the number of people that are going to be in the room with the patient. And we're all going to have to just wear masks. They're mandatory now in Massachusetts that if you're going out and unable to maintain 6 feet distance, that you need to have a mask. And it's going to be just patients will be coming with masks and staff is wearing masks. Also, we just have to be very mindful to keep the pace slower than it was. It's not going to be frenetic. We're not going to see 25, 30 patients a day. It's going to be a steady pace where we can be very careful. And it's so important to have a team that works together, to have the staff demonstrating the correct hand washing techniques and demonstrating the social distancing to help the patients understand this is what we're doing for their safety. So what about the patient flow? Well, we've thought that if patients can just wait in the car instead of coming into the waiting room, we want to try to eliminate the waiting room and not have a congregation of patients. So we're going to have less coming in the office. We're going to have them do the COVID-19 screening app and figure out, they could send a screenshot to us exactly what it recommends and what their symptoms are, if any. We're going to ask them to bring their own mask to come to the office. We'll do some screening prior to coming to the office with a temperature as well as a pulse ox. This isn't mandatory. It's just something I've adopted that I feel comfortable doing in the office. we're going to minimize the interaction with multiple staff in the office. So there will be an patient extender that is greeted the patient, will take the patient into the room. They're not going to be waiting in the waiting room. We're not going to be flipping through magazines. There won't be many chairs in the waiting room as well. But it's super important when we're doing this that we go over it with the staff. It's different than it was before. We have to get used to the flow so that we can show patients that we've practiced, that we have a safe practice, and we can demonstrate to them that we really care about them as patients, which we do. So what are the ground rules? Well, you have to wear appropriate clothing. So the clinical staff in my practice, I'm going to recommend scrubs to come in and their clothes, they're going to change into their scrubs. When they leave, they'll keep the scrubs at the office. We're going to send them out for laundry, and the same thing will repeat the next day. Staff that is, secretarial or the office manager, it's fine to wear regular clothing. We're going to do social distancing. We're all going to have masks. What's super important is just to avoid touching your face and wash your hands properly. Soap is very effective with this virus. It disintegrates the lipid layer very, very efficiently. So it's very important that you wash your hands, demonstrate for patients that you're washing your hands, because it really, really does help. And in this diagram you can see over here to the right, the first picture is just, the white is the bacteria on the hand. If the next one to the right is just washing the hands with and flicking off the water. And as it progressively goes, you're putting more and more soap and adding a little bit more time to it. So the bottom line is somewhere, starting to have 15 or 20 seconds of actual hand washing, and you can really eliminate most of all of the bacteria and virus. You can use hand sanitizer. It's definitely helpful. It's important to have that around the office, but it doesn't exclude proper hand washing. The same thing with gloves. We don't want people wearing gloves all over the office. You can't wash your hands. You forget you have the gloves. You touch your face. It's just a better habit to, if you're doing a procedure, gloves, yes. But if you're just around the office and working, wash your hands frequently, as opposed to wearing the same pair of gloves everywhere. Again, we have to be careful when we sneeze, that we cover ourselves and just use common sense. And what are we going to use for our protective materials? Well, the masks initially are just going to be the cloth masks that we have for the practice, or regular surgical masks. If we're going to be doing a procedure, then we're going to have to think about the risk stratification of the patient in the procedure, depending on what kind of mask we're going to use, whether it'll be an N95, whether we'll use face shield, whether there'll be a gown. It just depends per practice and what procedure is getting performed. We have to clean in a different way than before. We don't only have to clean the patients, the bed that they were sitting on, and wipe down everything that they had contact with. We have to iPads and iPhones and a credit card machine and computers and things that we've never really thought of. And the easiest material to use, the easiest solution is probably 70% isopropyl alcohol. We can use wipes, dicide wipes, so we can use a 0.5% bleach solution, but we just have to think more. There's going to be more active cleaning going on in the office. Everything that patients have had contact with, but also other things. Doorknobs are important. We just have to be really active in the cleaning process. So it's just a culture of being mindfully aware. So let's, we're not going to have food brought into the office to eat in the office. The weather's getting nicer out here. Encourage people to go out. Change out of your scrubs, but go out. We want to wash our hands early before we eat, obviously, and wear your mask when you're not eating. They need to be on all day, unfortunately. You just don't want to congregate in too close groups. You just have to pay attention to the social distance for now, and we want to set those examples for patients. So how do we fit in? How does a plastic surgery practice fit into this whole realm of what's going on around us, the chaos? Well, let's think a little bit about it. So plastic surgery patients are usually between about the surgical patients, and the injectable patients may be a little younger, maybe 20 to 40 years. So those patients are not the ones we're seeing on the right on the graph. They're not the ones that are dying of the disease. They're not the ones that are having the disease. They're not the ones that are hospitalized. And you can see in these graphs, the pink column about midway through, that's someone in their 50s. And anywhere to the left is younger than 50. The peach colored column, the tall one, is the 80-year-olds. And this disease, unfortunately, is really targeting people in nursing home and the elderly. Those are the ones that are dying, that are becoming hospitalized, and we're reading about. And on the graph, the bottom one, you can see that big blue circle on the right, and this is Massachusetts, that most of the people have underlying health conditions. So they're either obese, they have diabetes, they have COPD, and some of them have had previous hospitalizations in the past, as you can see in that center diagram on the bottom. So it's not the core population of patients that we're seeing in a typical surgery practice. Yes, we have outliers. Do we have obese people? Do we have massive weight loss people coming? Do we have people that are older getting facelifts? Absolutely. Do we have people with diabetes? Yes, but it's not the practice, but we're going to be careful. We're going to treat everyone as if they have asymptomatic COVID. That's just what we need to do. And the same thing with the staff. The staff has to understand that we want to be safe for the patients. We don't want to give the patients any kind of anxiety that they're going to get COVID from us, because it's a large population. We just understand that we're all here together to just continue as we go with a new norm. So we can assess the local risk. We have to prepare. There's a lot of preparing. As Sandy was saying, you have to do some trials with everyone in the office. We have to practice this new norm. So both staff and patients, we want to isolate. Anyone that's sick shouldn't come to work. And we have to protect ourselves, clean everything, and start very slowly and safely. Thanks.
Great. Thanks so much, Christine. We'll have plenty of time to discuss a lot of what was covered. What Bill asked and I decided was important also was to have something here really going over some basic hygiene when turning over a room for our staff, just to really make sure everyone's doing it the right way and avoiding cross-contamination. So I'm going to turn it over to Bill now to introduce the video that he put together for us.
Thanks, Jamil. So, I'm going to talk to you all about the gift that keeps on giving, and that's the Aesthetic Society COVID resource page. So you can see here on this screenshot, this resource page, as you know, you can access through surgery.org directly, and then there's a link to the page. Most of the links on there are really for the doctor, but again, this webinar and what we're trying to do is really give the doctor some more resources for your staff as well. So you can see at the bottom right, or on the left-hand side, there's red circle, the COVID educational videos. And those are really videos more for your staff. The 3 videos on there now, you can see those on the right-hand side of this. So there's 2 from the CDC, which are quite good on taking on and off PPE. And then Jamil had asked that we do one about just cleaning a room, because that's something that your staff is doing, but just to make sure that they're thinking about good technique. And so we're going to play that video for you briefly, and then I'm going to turn it back to Jamil.
Standardized templated technique must be used when disinfecting consultation and treatment rooms. Hands are washed with sanitizer and mask and non-sterile gloves are donned. Used patient disposable gowns, tray covers and other disposables are placed into the trash without cross-contamination. Approved disinfecting wipes are used to clean and wipe down all surfaces, including any surfaces touched by patients or healthcare providers. All hard surfaces are cleaned, as well as lights and chairs. Smaller containers are also cleaned in similar fashion between visits. All cabinet handles are cleaned. Please note, if anything needs to be removed from a cabinet or drawer, gloves should be removed, hands disinfected, and new gloves placed prior to opening and touching anything within the drawer or cabinet to avoid cross-contamination. Once the room is fully cleaned, the gloves are removed and hands are washed with soap and water or sanitizer.
All right, great. So that video is going to be on our resource page that you can review as staff. And I'm going to turn it over to Louie Rios in Texas. They were able to get back to providing medical treatment last week and surgery, and Louie Rios is in Texas. So he's been able to share some of his insight from the first week getting back into the office, not only himself, but in particular working with his staff and really trying to get everyone on the same page, get everyone comfortable, and get everyone back to work. So I can turn it over to Louie.
Thanks a lot, Jamil. It's a pleasure being here. And I guess I'm coming from the point of view of a state that's already starting to open up. And so about 10 days ago, we started doing surgeries in surgery centers, and we started back in our office-based surgery centers. And then this week, we started back with medical procedures, which included Botox and injections. And then as of tomorrow, we're going to kind of start back on some of the med spa procedures like dermal infusions and cool sculpting and things like that. So it's in our state, it's been rolled out slowly. The language is always confusing. So my first point is, you know, whoever's going to be the COVID manager, and especially the physician, needs to know the laws and the guidelines. And sometimes you've got to be reading 3 sources, like the governor's orders, then you've got to go to your medical board's orders. Then we have a Texas Department of Licensing that licenses our cosmetologists and estheticians, and they're all coming in at different times and having different things happening and opening up. So you've really got to be clear on what the laws and guidelines are and what is opening up and not opening up. And so like in Texas, what we kind of saw open up first was our medical practices and medical procedures. And what that meant is we could delegate, properly delegate to those people in our offices, the injectors, to be able to do like Botox, cosmetic, and Juvederm. But we were not allowed to do the med spa type procedures like dermal infusions, like cool sculpting. And so, you know, this is where leadership kind of has to take place to be able to know what you should be doing. And we'll talk about why that's important next. So when we did start getting the indications that we were going to open up, all of a sudden it's like, oh my God, you know, this day is coming. And so what's really important is that you got to start the communication. Now in my office, I did have my staff working part-time, so we were communicating on a daily basis, but I could imagine in practices where people have been furloughed or laid off, you know, you're going to need to bring people in and start communicating. And the way that you need to communicate is actually everybody talking together. It's just not the office manager or the physician talking down to the staff. And in plastic surgery offices, we sometimes see a segmentation of the office, and we see it in my office where I have an OR side, I've got an office staff side, I've got a med spa side. And a lot of times during the year, we're all kind of working independently and we kind of bump into each other and we have to work together a little bit. But we kind of make a joke, hey, that's the front staff, that's the back staff, you know, that's the meds. Now we have to all really work together, and it's really teamwork, because the front staff has to help with the screening for the med spa. We got to help with our protocols going into the operating room. So now is a time where communication is very key and teamwork has to start. So when you have your first few meetings, what's really important again is that it's not just one person talking down and laying down the law. It really needs to be an exchange of ideas where everybody is listening to each other, because maybe the office manager or the physician has come up with some sort of plan and maybe it's not really that practical, you know, and so maybe your nurse injector, your medical assistant or nurse might have a better idea and way of doing it. And so when we sit down and have this meeting, it's real important. Everybody just listen to each other. Everybody respect yourselves and your opinions, and then try to come up with the best plan possible. So once you've had your meeting, you've kind of talked through it. And I think when I went back and talked to my med spa staff, this was probably the most important thing here, was gathering all the stuff. You know, we talk about PPE and the masks and all that, but I don't think they felt comfortable until they actually saw those N95 masks show up in my office, those face shields show up in my office. When they saw that, they knew that we were serious about their safety and they felt a little bit more comfortable. So, you know, the physical things need to start popping up, like your protocol books, your communication scripts, your questionnaires and consents, the cleaning products, and any signage that you might need across the office. I think once you start seeing the physical things pop up, it starts becoming like, you know, more realistic that you're going to be opening up. And I think people start getting a little bit more confident with that. So once we decided to get started, and, you know, people were very, very nervous about this, you know, and again, I never pushed hard, like, okay, we're going to see patients, you know, we've got a backlog of patients and we're going to see patients every 10 minutes because we've got 100 bazillion Botox patients. No, you know, I sat down with my med spa staff and I sat down with the OR crew and everybody and kind of went through, like, what do you guys feel comfortable with? You know, let's start real slow. Let's limit our appointments. And then we started, you know, getting the process together and informing real important to inform your patients of the process so that they know what to expect. So if it's a med spa patient, they're told, like, you're going to come without your makeup. You're going to have your hair in a ponytail. Don't bring anyone. And it's going to be a quick in and out visit. There's not going to be a lot of chit chat. We're going to get you in and out because we want to keep it safe for you. I think once you get, you can also get the patients involved so they get in on the flow as well. And then what we did is we started with simple procedures like Botox where patients weren't taking off their masks. So we could kind of test our protocols and go through our protocols. So starting slow, starting with simple procedures, getting your patients involved, having your staff very comfortable, I think really helped with the process. And then once we started getting comfortable, because I'll tell you, my med spa staff was, you know, they were very concerned. And so once we started the process and started going slow, you know, after the first day, we got together again and we discussed the process, you know, and how it went. We listened to each other. We got to be very respectful to each other. And then we made our adjustments. And then as we made our adjustments, we started seeing that our staff became a little bit more confident. And then they actually started asking me to expand the services slowly. So now we're up to doing the injections of the lips and of the cheeks and all that. And I kind of let them feel comfortable and confident. I wasn't the one pushing. They kind of came to me after a day or two because they felt very comfortable with the PPE and the protocols. So this is my last slide, and I'm also the president of the Texas Society of Plastic Surgeons. And you know, the way that the governor's orders come out now is so confusing. You don't know if your med spa can start or not and what procedures. And so my advice really is when you do get back up and running with surgery and with med spa procedures, just really go slow and easy on the social media. And this was brought up by one of my injectors. You may still have some primary care offices that are struggling to get PPE. And if you're showing yourself off on social media and all that, it's just not going to be very good optics. The other thing is with that last point there, following the rules, sometimes your governor's orders or the orders from the medical board may be very vague and, you know, just real confusing. And so one practice or one med spa may interpret a rule as like they can't be open. And then they see that you're open. And if you're flaunting it on social media, they may send the city over to your office, even though you're not doing anything wrong. And it's happened to a few members at the Texas Society of Plastic Surgeons where the cities come down and tried to shut them down, even though the governor's order has said that medical practices can stay open. Because you see, sometimes the cities and the counties are not as educated as we might be in the executive board of the Texas Society of Plastic Surgeons. And so if you're flaunting it and really getting out on social media, you know, you might really set yourself up to get visits from the cities and get fines or get closed down and then have to get a lawyer. So just take it really easy. And so what we did is we just started working with our existing patients, calling them on the phone, letting them know about our protocols. And, you know, after about a week, we sent out some emails just to our database, just to let them know that we were opening, but that we were doing it under cautious circumstances. So those are just some tips that might help you when you start getting going again.
Great. Thanks so much, Louie, and to Bill and Christine also. A lot of great information, very practical information. And I'm going to get our presenters to turn on their cameras now. And we have a lot of time here to discuss what's been covered and also some other things that are going to be useful for our staff. You know, I think one of the first things, and that I'm going to get Herluf give his insight on is I think a common thread in this and throughout the past few weeks has been the importance of teamwork and also of leadership. And it's not just the surgeon, there are different people within the practice that act as leaders. Herluf, what are your comments about that?
Well, first of all, excellent presentations, everybody. Thank you for taking the time and hard work to put those together. You know, you're right, Jamil. There's a common thread that's showing up in all these. And one of the first things I think is that you have to instill a sense of confidence. And you have to remember your staff is coming back. They've come through a lot of uncertainty. Many of them have been furloughed. They're uncertain about their health as they come back and the safety. So you have to give them a sense of confidence because they're going to follow you if you have a sense of confidence also. No one follows the general over the hill, says, you know, we're going to win the battle. Maybe, I think, I'm not sure. You know, they want to follow you because they believe in what you do. So you have to instill that sense of confidence. You also have to actually do what you say you're going to do. You can't be the person that sits there and tells everybody, hey, you guys have to do it safe. You got to do this. You have to be the person that does it and follows it to the letter. They are going to follow your example. And if you don't do it, then they're going to go, well, Dr. Smith doesn't care, so why should I care and do it, you know? So you have to set the example. It's kind of like, I'm not saying staff and children are the same, but, you know, as a parent, you know, if you don't do it, the kids pick up on it right away. Your staff's going to see that. You know, it was emphasized before about teamwork. When I talked to my staff the other day, we talked about a chain. Every link in that chain makes the chain work. Any link in the chain that's weak doesn't help us. It snaps, it breaks. So everybody in the test to buy in, everyone has to be part of it. And that includes what Dr. Rios so beautifully said, is you've got to empower your staff. You have to make them know that they are just as important. They can stop the process. They see something, they can put their 2 cents in and their opinions in, because that's important. That's how we learn and progress forward. And just think of it this way. They're trusting you to do the right thing. You have to in turn trust them backwards. And when you share that mutual trust, Jamil, that's what makes this whole process ultimately going to be successful.
Yeah, I think that's all good points. You know, personally, I actually do call once every 6 to 8 weeks at the university hospital. And, you know, it's been really, they've kept most people out, only essential healthcare providers. So my residents called me on the weekend, said, you know, there's a lady in the ER that has a hand infection. And, you know, normally I just let them do it, but I felt the necessity to go down there myself, put on some gear and do it with the residents as a matter of making a point, you know, that we don't want to be pushing them out there on a ledge without being willing to be out there on the ledge with them, if that's where indeed we are, you know. Now, Sandy, you work with practices, you've worked with many practices now since this has begun, essentially for us 7 weeks ago. What are your observations with this? You talked about the Coed Coordinator, which is important because that opens up lines of communication, but what are some tips you can give our members and staff as they return to work over the next few weeks?
So I think everybody's done a really great job because it truly is about communication and just really making sure that everybody feels a part of the solution. I think sometimes we dismiss people's concerns or anxiety of maybe coming back, and we can't do that. And I know people will say, well, who would do that? But I have heard that from some staff members that they felt like they weren't being heard. And so that's why, you know, one of the reasons why we decided we really wanted to recommend that type of, like Dr. Rios has said, a COVID manager. We call it a Coed Coordinator, because it's important that you make your staff feel welcome, and, you know, that it's, you know, not just welcome, I shouldn't have said that, safe when they're coming back. I just think there was a lot of great information here. One of the things that, you know, as we've been talking about all the things that we need to do, you know, I know it's not on topic completely, but I still think we need to consider and really talk more about ensuring that we are continuing our virtual consultations. I think some doctors, as they've been coming back, I've seen that they're trying to still bring all the patients in. And, you know, I have many practices that are still doing, you know, 55% conversion rate from, you know, the virtual consult and giving a deposit that day. So if they're done correctly, I mean, you're able to keep a subset of patients out of your practice. And so, you know, I feel like sometimes we're in a rush to go back, and some practices have had it so the coordinator can then still work from home for a little bit, which again keeps people out of your practice. So I think there's a lot of things to consider. I think we're back in black. You know, Blaine played that great song, you know, yeah, we want to get back in the black, but we need to do it safely.
Yeah, I think that's really important, Sandy, that, you know, it is a different world out there, and both Christine led with it and Louie mentioned it, is that you've been at home, you haven't been able to work for a while, and your knee-jerk reflex is, I need to get back in, I got to operate a lot, I got to see a lot of people, but it is a different world we're re-entering. And, you know, every interaction in person adds up. You know, what we're trying to do is both temporally and spatially create distance between people and limit contact as much as possible. So I think it is important for people to consider continuing some aspect in their practice virtually, just to decrease the volume of people passing through. One thing that you know, we've been on so many webinars and meetings and chat groups, as I'm sure a lot of people who are attending this have been on. And one of the common themes that at least I've picked up from all of this discussion is the importance of screening questions, you know, before the patient comes to the office, before they come in contact with staff and other patients. Christine, can you elaborate a little bit more about the importance of that, and how it's important that our staff who are on the phone, who are the first line talking to the patient, have to be able to be good historians? What do you have to say about that, Christine?
Well, I think it's very important to figure out exactly how the patient's been. You know, do they feel sick? Are they in contact? What kind of job do they have? We have to kind of just tease out their risk factors and see whether they'd be someone we'd ask further questions about. You know, have you taken care of a sick family member? Have you been, you know, going to the hospital? Is your husband work as an EMS? You have to think about these things and try to kind of tease out the questions, because you're trying to just do a risk assessment of the patient.
Mm-hmm. Yeah, it's so important. And, you know, that segues nicely into this other hot topic that seems to come up every time we're on anything related to COVID-19, is testing. Bill, what are all these tests people are talking about? Because people say, oh, I'm going to go tested. That's a very wastebasket term. What are the different tests for? And what are some of the downsides, which may be why we might not be using testing as widely as some would hope that it was going to be the answer for every problem? What do you think, Bill?
Yeah, I think that there's a lot of confusion about the testing, and there's you know 80 to 100 now tests that are out there, and all 300 people that are on this webinar, I'm sure, have their own opinion about what they think is the right thing. My recommendations at this point would be, number one, and this is true of a lot of the things that we see on the chat even now, the question is, look at your state guidelines, because the state guidelines, as Louie mentioned, they're different amongst the different states in the United States. Now, there are some commonalities, and I totally agree with the primary screening is the history and the temperature checks, and that's been proven time and time again globally to be very effective. To answer your question, Jamil, so, you know, there's two tests, one test for the virus. So that's what people call the PCR test or the nasal swab test. Now there's some other ones out there that are testing from saliva, and then the other test is the antibody test that shows exposure. The problem with all these things is we just don't know what the accuracy is. And I would caution you to watch out what the companies say the accuracy is coming from the company. And there are no tests right now that are completely validated. Even the CDC test, which was the only test a month ago you could get, and you had to send it to the CDC, ended up having 35% false negatives. So you just have to be careful. Personally, I think Christine's comments are very good. What we're doing in Texas, there's no testing mandated. And it's actually defaults to the center. So the hospital or center may mandate a test, and obviously you would need to follow that if you're practicing there. But I think that you as a practitioner may decide, like, for example, as Christine mentioned, there's certain things, like I think dental hygienists have the highest incidence for exposure based on the current data. So if you have somebody you think has a high incidence for potentially being exposed, a nurse, for example, or a first responder, I think it's fine to do a test. I think the most of the people would say then you need to send that to a real lab that does the PCR test, and I think that's the going mantra. But again, I would just caution people, and I've been on chats and I see all that. I mean, there's a lot of opinions. It's just that we really don't know the accuracy of the test. So personally, unless somebody is high risk, I'm not required by my state or my center to do testing. So we're doing screening and temperature checks.
Yeah, I think that's really important, because you just hear about this term, a test, and people start saying, well, if I get a test and, it's negative, I'm okay. I don't need to wear an N95 during induction. The worst situation about not testing is testing and getting the wrong answer and having a false sense of security and exposing yourself, your staff, your patients to risk. So I think right now, as Bill's highlighted, until we have much more information and potentially even different tests that are more accurate in the process around testing, we just have to assume and take the appropriate precautions based on what we're doing, where we're doing it, and then also understand what our local legislation has to say about the necessity. Now, one other thing that I was thinking also is you alluded to, Bill, and maybe Louie, you can expand on it. When we talk about these screening tests, they're presented almost in a very uniform way, like we ask the same questions to everybody. And that's a starting point, but there are other things that make patients potentially higher risk to have been exposed. Can you highlight some of those things in the history that you've told your staff to look out for?
Yeah, so I think definitely, you're going to start with, do you have COVID? Are you taking care of someone with COVID? Are you a nurse or EMT or a healthcare worker that's been in a COVID unit or screening COVID patients in the emergency room? Those are all like really super high level. Like maybe you just don't want to be bringing them in right away as the first people to get Botox and all that, right? Yeah, those people you might want to just kind of reschedule, politely tell them we're going to reschedule you. And then, hopefully as time goes by, we get more answers on testing. Or we had a nurse who was taking care of COVID patients and she got COVID and eventually she got cleared by her infectious disease doctor. But we kind of, again, politely demanded to see the documentation that she was cleared to be able to, come back out into society and all that. And then, okay, we brought her in and did her injections. So I think that's where you really need to go. And you'll see that your staff is going to get really smart about this because it's really their safety, and so they're kind of evolving as this whole process is evolving, because it is their safety. And it's really amazing because they come back to me and tell me a bunch of stories of, people they've caught, in the screening and how they've kept them out, and we've had a few people come in with high temperatures and we've had to, reschedule them too. So I think as you start getting into this, the process will start doing what it's supposed to do and it will be successful in helping you.
Herluf, we've been on so many webinars, as I'm sure all the members who are on here, but for our members, staff, and our own staff who may be on this or may watch it, why potentially, if my esthetician is in New York and she calls her colleague who's in Washington State and they say, hey, what are you guys doing for testing? Or, are you wearing visors, or have you even opened up yet? Why is there such a wide variety and of what's going on right now with practice and what's being done in each practice? I think the staff really have to understand that. What are the reasons for that variation?
It's a great question because, we're always comparing you look at the news and they're always comparing our country to other countries around the world. And we have to remember we are 50 different states and each state actually works independently We have some federal overlying guidelines, but it's not like other parts of the world where the federal government mandates and it goes down to everybody below. We have Massachusetts that follows one line. We have New York's that's obviously is going to be a little bit at this point on the more cautious state, shall we say. We have, other states like Oklahoma and Texas, the prevalence hasn't been that high in. So each state sets the regulation, and then that also then boils down to each region does, because inside the states, certain regions can control. So that's why there's such this mix mash across, and it makes it very hard when staff ask you, because they get on the internet and they say, well, what happened? Why do they in New York are having to do this? And why in Texas are they doing this? And the answer you have to say is, you have to, and I think Christine alluded to this earlier, you have to know your local environment. And what's going to work in St. Louis is not necessarily going to be what's going to work for New York City. And you have to explain to your staff as life goes along and as things happen. One of the things that's going to happen with testing as life goes along is that we're probably going to, right now where people think of using testing for, I'm going to rule out somebody is infectious going into the operating room. What's really ultimately what the purpose of testing is going to be is going to kind of establish the prevalence of COVID-19 across the country. And then based on that, you can then judge risk factors. Right now, we don't know that number. So your staff, you just have to explain, it's 50 different states, it's 50 different governors, everyone's acting on their own way. Follow your local guidelines. That's the most important things. And don't just say, well, because they're not doing it in Oklahoma means me in New York, I can get by with it, because that's how you're going to get yourself in trouble. And as Louie says, that's when you get the local enforcers knocking on your door.
Yeah, I think that's so important, those points. And I think we have to all remember that even locally where we are, the impact on healthcare resources, some communities have a lot of capacity if there's an outbreak or a surge. And then the other thing is the access to supplies, and everyone knows now what PPE stands for. A lot of people didn't know what that stood for 8 weeks ago, but we all realize that there's the importance of having enough supplies within that region, and that actually varies quite a lot throughout North America as well. There were a couple of questions that came up on the chat that I do want to hit for the people in attendance. So people had a lot of questions related to, what do we do for, non-surgical treatments like lasers, so ablative lasers, hydrofacials, and procedures like that. So does anyone have an answer? Like, Bill, what are your thoughts with that?
Yeah, I think there's two things, and there were a lot of questions about that. And I think that again, state guidelines may vary, so you need to kind of check that. The other thing is that the Aesthetic Society COVID Task Force put out their document on Tuesday. That's on the resource page. You should have it in your email. I would recommend that to you because it goes through in very good detail much of what you would do. So the big thing is if it's a facial procedure and the patient's not wearing a mask, you need to make sure the provider's maximally protected. So, it's either an N95 or if that's not available, a 3-ply mask and a face shield if you're doing, let's say, a lip injection. But again, I would refer people to that guideline because I think it's very thorough and very good. And I think you'll find it useful to look at that in detail.
Mm-hmm. And people were asking all kinds of questions. And I think right now we all know that there's quite a lot that we don't know, that we actually don't have any good scientific evidence, but there's actually quite a lot that we do know. What we do know is that COVID is a respiratory disease, that it's transmitted through respiratory secretions and also saliva. It also has a significant gastrointestinal component and can be transmitted through secretions. One thing that the blood banks are saying, at least here in Canada, they do not test for COVID or any other coronaviruses because there's been no good evidence that it's transmissible through blood transfusion, okay? There is a lot of other things we don't know for sure, like in a laser plume or cautery smoke, whether it can be transmitted. Certainly people think of cautery with HPV, right, condyloma that can be transmitted. There are a couple of bacteria like staph and Corynebacterium that can be transmitted through plume. the fact of the matter is that we don't know for sure. There's no evidence right now related to this. But at the same time, I think when we're thinking about cautery, we're not typically operating in the respiratory tract, right? And probably the more significant thing when people talk about nasal cases is potentially aerosolization of the nasal secretions and saliva as opposed to blood products. So at this point, you know, we have to use the precautions that we use, but at the same time, we also have to use the existing evidence for other things to really try to understand that. So if you're dealing with respiratory secretions, GI secretions, that's a known entity. But smoke plume from blood, probably unlikely, even though we can't say for sure, okay? Do any of the other panelists have any last tips or things that they think are going to be important for our staff going back? Louie?
Yeah, again, you know, I would start with, you know, when we're talking about hydrofacials and the lip injections, I'd probably start again with procedures where you don't have to remove the masks so that you can, you know, gain the confidence in your protocols and keep your people safe.
And Herluf, how about you? Going back to practice, you guys aren't in there yet, but you're gonna be opening soon, right?
Right. I think, again, start slow, regain your confidence. It's just like riding a bike. You got to learn how to do it. And you start out slow with the training wheels. And I like one thing that Louie also said. Remember, think about the optics you're creating in your community. If you come out also right away blazing full speed on your social marketing and that, we're living with a population of people that are very nervous right now. So start slow, be sensible, appreciate the nerves of what's going on in your community around you.
Christine, what thoughts do you have as you're looking to return to practice for your staff?
I'm looking forward to meeting together with them, going through some dry run, seeing how we don and doff the PPF, do practice runs with, you know, have a staff member be a patient just to see how the flow is, so you can get used to it and be confident, and have them be confident wearing the mask and moving around the office.
And Bill, you just got back to practice, so what do you think would be a useful tip for the staff that are going to watch this webinar?
Yeah, I think to have confidence in the process, that we, you know, a lot of the things in these resources are just, again, Louie said it really well, that it, you know, everybody's got apprehension, but that fades pretty quickly. And that's what we've seen, certainly both in the office and in the operating room. People gain confidence in these recommendations, and they do work. And I think as you do that and your staff gains more confidence, that they'll feel good about things. And my staff's really enjoyed coming back to work. You know, sitting at home gets old for people. And so it's been a good positive experience thus far for everybody.
All right, and we're pretty much at the hour, so I'll close with a couple of thoughts. I think one is for our colleagues, the plastic surgeons on this, and your staff. You know, we have to all remember that we have a tremendous amount of power and influence in this process. It goes back to the basics with very good hygiene, you know, the hand washing. It's been the same for 2 months. That's probably the only thing that's been the consistent theme, is hand washing and really avoiding spreading and contaminating yourself. And I think we have to make that point both personally and with our staff, that's the way we have to conduct ourselves now, not just in the practice, but when you go to the store and go grocery shopping, and to just be more vigilant than we have been in the past prior to this pandemic. The second thing I want to say is a very sincere thank you from the Aesthetic Society and our members, to Blaine, who's been QBing this from day one, to Sandy, who's been on so many of these webinars with us, to Jeff Nugent, who was on the webinar and really gave Blaine and Sandy the green light to support our society and our membership, and now our staff. So we really, really appreciate everything Sientra has done for the Aesthetic Society. And then finally, just to remind everyone, if your staff wasn't able to watch, Blaine is going to edit this, get it turned around, get it up on our COVID-19 resource page for the Aesthetic Society. So you'll be able to let your staff watch some of this and get some powerful information that's going to really help them become successful, get back to work and be successful within your practice and in your team, okay? So I want to thank everyone for coming on tonight, and everyone enjoy the evening and the weekend coming up.
Thanks all.
Thank you.
Everybody.
Blaine.
Thanks, Blaine.
Thanks, Blaine.